Good morning, students. Today we'll be discussing on the topic mandibular major connectors. So before going into the details of the mandibular major connectives, let's discuss first on the cars partial denture parts, which consist of the major connector, minor connector, res, direct retainer, indirect retainer, denture base, and artificial teeth. So what is a major connector? Major connector is that part of a partial denture that connects that part of the prosthesis located on one side of the arch to the parts on the opposite side. It consists of both maxillary as well as mandibular major connectors. Today, we'll be discussing detail on mandibular major connectors. So what are the requirements for a mandibular major connector? It must be rigid without being so bulky so that the patient will be comfortable to use the partial denture. It should not impinge upon the movable tissues of the floor of the mouth. So that might cause the lifting up of the prosthesis. So that should be avoided. And the associated freni or mandibular tori should not be impinged by the partial denture. So coming to the types of the mandibular major connectors, which includes the lingual bar, lingual plate, double lingual bar, and the labial bar. There are a few modifications for some of the types of the mandibular major connectors. Let's discuss in detail on each of these. Coming to the lingual bar. Lingual bar, as you can see in this picture, consists of a bar of the mandibular major connector covering the lingual tissue that connects the components of the cast partial denture on either side of the arches. It is the most frequently used design, and in its cross section, as you can see, it is half pear shaped, with the broadest part at its inferior border nearest to the floor of the mouth. So what is the requirement for placement of a lingual bar? What all you should take care? So with the perio probe, you need to measure the depth of the lingual sulcus, and you must get an 8 millimeters of space between the gingival margin and the floor of the mouth for designing a lingual bar. So why this 8 millimeters of space? So this will permit 5 millimeters for the major connector height and 3 millimeters of clearance from the gingival margin. So in total, you need an 8 millimeters of space between the gingival margin and the floor of the mouth. So the advantages of this lingual bar includes a simple design, minimal contact with the remaining teeth and soft tissues, decreased plaque accumulation, and increased soft tissue stimulation. So this is definitely going to be a good design for your patient. But this lingual sulcus depth is a major criteria for the placement of a lingual bar. So what is the disadvantages? If extreme care is not taken during the construction, the framework may not be rigid and it cannot be used with mandibular tori unless it is surgically removed. So coming to the next design, that is a modification of this lingual bar itself. It is termed as the sublingual bar. So let's see what is that design. So when there is insufficient height of the lingual sulcus, that is if there is no 8 millimeters of depth from the gingival margin to the floor of the mouth, you can go for a sublingual bar. The placement of sublingual bar is inferior and posterior to the lingual bar, lying over and parallel to the anterior floor of the mouth. The major disadvantage of this sublingual bar design is interference with the lingual frenum. So the interference with the lingual frenum can definitely cause the lifting of the prosthesis in function. So that is a major drawback of this design. Coming to the next type, that is lingual plate. Lingual plate, as you can see, it covers both the tooth as well as the lingual soft tissues. It is a half pear shaped in cross section with thin solid piece of metal extending from its superior border onto the lingual surface of the anterior teeth. And the inferior border is located as low in the floor of the mouth as possible without interfering with the movements of the tongue. So this is a lingual plate. You can see the gap between the teeth. If there are open embrasures for your teeth, for your patient's teeth, then your superior border should be scalloped. And this particular modification of the lingual plate is called a step back design. It must be considered in case of open embrasures for the aesthetics. Otherwise, the metal exposure from the anterior view is going to be anesthetic. So the step back design should definitely be promoted when you're doing a lingual plate in case of an open embrasure. So the lingual plate should be supported at each end by rests no farther posterior than the mesial foci of the first premolar. You can see the red arrow pointing towards the mesial foci of the first premolar. So that is a major criterion for a lingual plate. So what are the indications that you choose a lingual plate? Mandibular major connector. When there is insufficient space that exists for a lingual bar, or when there are one or more anterior teeth that are periodontally compromised and warrants their replacement in the immediate future, when there is a need for indirect retention, or if the patients with conditions that prevent removal of mandibular tori, then you can use a lingual plate. So the major disadvantage is the extensive coverage. It covers the tooth surface as well as the lingual soft tissue. So the covering the tooth surface may contribute to decalcification of enamel in your patients with poor oral hygiene. Coming to the next design, that is a double lingual bar, also known as a Kennedy bar. You can see in the picture, there are two bars, one lingual bar and the other one on the tooth surface. That is why it is having the scalloping. It is different from the lingual plate in that the central metal piece is missing. It is separated. There are two bars. That is why it is known as a double lingual bar. So the position and contour of the upper and lower borders of a double lingual bar is similar to a lingual plate. The lower bar is similar to lingual bar. The upper bar presents a scalloped appearance. It should be supported at either end by occlusal rest. So preferably on the mesial foci of the first premolar. So what are the advantages of a double lingual bar? Effectively extends indirect retention in an anterior direction. Since the gingival tissues and the interproximal embrasures are not covered, marginal gingiva receives a natural stimulation. So what is the disadvantage of a double lingual bar? In cases with lower anterior crowding, intimate contact with the tooth surface cannot be maintained, resulting in food entrapment. Presence of multiple borders make it annoying to the tongue, so patient discomfort can be on the higher side compared to a lingual bar design. Coming to the labial bar, you can see in the picture there is no mandibular major connector visible on the lingual side. It is located on the labial side. So what do you think would be the indication for a labial bar? If the tooth are lingually tilted or if there are any major undercuts in the lingual side, you can definitely choose a labial bar. So the labial bar runs across the mucosa on the facial surface of the mandibular arch, indicated only in cases where gross interference prevents the use of lingual major connector. So coming to the indications of a labial bar, if there is a lingually inclined or if the mandibular teeth are malpositioned or if there is a large inoperable tori in the mandibular region, lingually you can definitely go for a labial bar design. So the placement is a bit difficult. So that is why there is a modification known as a swing lock removable partial denture. It is a modification of the labial bar major connector The modified labial bar has a hinge at one end and a locking device at the other end. So the advantage is it has a like a gate like design. You can open and close. The opening and closing action permits it to reach otherwise inaccessible undercuts on the labial surfaces of the teeth. So coming to my conclusion, the mandibular major connectors, there are array of mandibular major connectors available. There are basically 4 types of design: the lingual bar, lingual plate, double lingual bar, and the labial bar with sub modifications for some of the types. So in the diagnostic phase itself, you should choose the design for your cast partial denture according to the patient's demands, according to the physiology of the patient and the space availability. So choose accordingly and design a good cast partial denture for your patient. Thank you.